Hi, so as you just learned, I do own a dental office here in Rylander. It was my father's practice beforehand. I did go to school in larger cities, and then I did come back to Rylander. I do still have some friends in the larger city areas. One of the things that I noticed in dental school, and is a large trend, is that a lot of dentists, when they're in dental school and they're deciding where to practice, they want to go to the large cities. There's a big pull for dentists to go to Madison and Appleton and Milwaukee for a lot of reasons. One, there's more to do in the larger cities, but then there's more casework. There's those larger cases, full mouth rehabilitation that I think lures some dentists to those areas. And then there's this huge kind of demand for dentists in the rural areas. But I think that kind of makes it kind of a reason for dentists to want to come to rural areas is that there's less competition, and you're really kind of filling this need. So for me personally, I love the rural area. I couldn't imagine living in a big city, even though I did for school. And I do like that it's not as competitive with the dentist on every block. I feel more camaraderie with the other dentists in town. Another thing that, not always true, but you see general trends, is that in rural areas there's less corporations, less large groups, and there's smaller group practices, or like myself, a solo practitioner. Way back in the day, you saw that as the most common business model, not only for dentistry but for medicine, and it's kind of this dying trend, especially in dentistry. But in rural areas, it's still really thriving. That small practice that's owned by the dentist is doing, I think, really, really well. And the reason that I really like owning my own small practice is I get more flexibility. And there's that sense of ownership. It's my baby to kind of take care of and then set up how I feel fit. And you can kind of match the community values. They're values that usually you have because you live in that community, and then you just kind of know how to, best serve the community. Like, for example, when I walk into an office, I'm not necessarily looking for the shiny new marble counters. I'm looking to feel valued, and I'm looking to feel heard. I don't want to feel like just a number that's coming in and then leaving. I want to relate to my practitioner, and I want to almost kind of have that friend feel. And I think when you're in a smaller practice, you can kind of set it up to still have that feel. One of the things that has been happening a lot, especially with the baby boomers kind of retiring, and there's this kind of need for dentists, especially like I said in the rural areas, is some practices can't sell to another dentist and they just go out. I've had dentists that have retired and then have had patients travel 45 minutes away to come to me or to other dentists in Rylander because their dentist went out and it was the only dentist in their small town. But what will happen if they can't sell sometimes is they'll sell to like a larger corporation or a chain. And not that they're bad, they're not, and there's some benefits to doing it that way. But some of the chains, they have a really set business model. And so things that you kind of hear in the dental community is like the small mom and pop practice, and then someone will come in, and then whereas I let my hygienists pick how much time they need for each procedure, they'll take that hour and they'll condense it down to 45 minutes and say, okay, you only have this much time, and by the way, you need to do these extra things, and by the way, here's this quota, you need to do this much of this procedure and this much of this, and kind of more of a business model. And so I think sometimes people will see it as kind of salesy, and you kind of feel more like a number. And for me personally, like I am horrific at anything sales oriented. It makes me ridiculously uncomfortable. I will walk out of a room when it comes to even discussing treatment sometimes because I want people to have the ability to say no. It's their mouth. If they don't want to, they don't need to. I want them to be healthy, but I want them to have that autonomy to pick what they're going to do. So I think for me and for other staff members, that model would be less satisfaction overall. Like I said, it's some generalizations, but definitely I think that's where the small rural practice can really thrive. As far as COVID goes, I don't think I'm unique. I think every business was hit really, really hard. In our particular case, in March, the Dental Society came out and said, you need to shut down for 2 weeks. We need to stop the spread. We need to conserve supplies, and we shut down for 2 weeks, which turned into 2 months. In those 2 months, because I was small, I was able to keep my doors open for emergencies. I was there every day that I would have been, just for less time. We just kind of, cut down our staff and our hours, but we were still there to serve people if needed. Some of the bigger places just completely shut down and said, good luck. But in those 2 months, we had to really figure out how we were going to navigate what was going on. And what's hard for anyone, in the sciences or the medicines, is that we want to see research on what's the best way to reopen. What did the research say? And there was no research. Nobody knows how long it took to kill COVID, and so there was a lot of guesswork. But the ADA thankfully put out a pamphlet and said, okay, here's your guide to reopening. It wasn't like you have to do it this way, but it was a whole list of suggestions, and most of it people have heard of now after all this time. But so when we opened up, we had the barriers and the hand sanitizers everywhere. Everyone was wearing masks. We were wearing N95 masks. We screened you when we called you. We screened you when you came in. We took your temperatures. We had people waiting in their cars. So we had to kind of relearn how to do that. But really, we hit the ground running. 2 months of not seeing patients means we had a big backlog to, catch up on. And it was just busy from day one. I mean, we have not stopped running since that time. I recently, in the last week or two, actually got something from the ADA, and it was a survey that they've been doing since the shutdown, that, they would ask a dentist, well, how many patients are you seeing per week? How does that compare to pre-COVID times? And what they're finding is that there's a big separation, and that rural America it is really humming. We're really seeing the patients. We're really back to pre-COVID levels because we have to. I mean, there's a demand. We just have to see those patients. And they're not quite back up to pre-COVID levels in more of the cities. And there are a lot of reasons they thought it was. I don't know if I agree with all of them, but some of it could just be mandates in the large cities versus the rural areas, or just the fact in rural America there's just less dentists, so we just had to do what we could do. For us, that first summer, to kind of offset the tidal wave of things that was going to happen, we all increased our hours. I have a really nice staff. Everyone said, yeah, sure, I'll work more. So instead of 4 days a week, we were 5 days a week. There's only one of me, so it was one extra day with me. But on my hygiene side, I have 2 hygiene rooms. Instead of those being used, some of the time, we work 2 hygiene 5 days a week. So we really increased everything to try to get through what we were behind on. And at least for cleanings, we definitely mostly caught up. On my side, I think I started to catch up, but there's this post-COVID surge that has nothing to do, I think, with those 2 months shutdown. And so we're still really busy, and I see it with other businesses, whether it's an arborist or, you hear all on the news all the time that they're booked out a year or 2, and the wait times are dog groomers, I've heard. So, and I'm not sure what's causing it, but we have stayed consistently busy since we opened back up. So we kind of had to change a little bit in that sense because, we just had to meet the demand. So in my particular case, what we ended up doing is we ended up hiring extra auxiliary staff. There's only so much I can delegate, but I learned to delegate, which is hard because I can want to control things sometimes. And so, for example, my new hygienists, they can numb for me, and I learned really quickly that they're as good or sometimes even better at getting patients numb, and then I was able to do more things with the time that I had, so I could get more of my patients in pain and try to meet that need. We also started scheduling smarter. If somebody calls in pain, I was usually the one that saw it and took the x-ray, and I'm like, okay, the hygienist can see it if she has an opening, and I'll come in, and whereas I used to put it in my time. So we were able to kind of schedule smarter. So I've actually seen more patients, when I talk to my accountant now than I did before COVID. So I've definitely seen an increase in business. So I would say definitely, I think from that study is absolutely correct that in rural America, dentistry is definitely thriving. I haven't seen new patients in a year. Hopefully I'll get back to that at some point. I'm still trying to get my numbers down to a manageable level. But definitely would say everything is thriving, but I still feel like we're keeping that small office vibe, that thing that I think makes dentists in rural America kind of more fun or more unique, like Dr. Schindelholtz with his fun commercials, which I love, or like for me, I really love the holiday season, so I spend a full day with my cousin decorating for Halloween and 2 full days for Christmas. And when you have patients come in and they see everything everywhere, their eyes just light up, and it's just that little extra touch that it makes them smile, and then I smile, and then it just is such a nice vibe to have in the office. And then all my staff have been just so great through everything, and they all give ideas and suggestions, and it kind of just feels like this fun, coffee addicted family that just all gets along and just kind of makes it work. I don't know if it would be possible in a big city in a different vibe if I could have that. I'm sure some places it can, but I think in rural America it really works. And I would say that's why dentistry, for me, in rural America is definitely thriving. Thank you.